Good morning, everyone. Um, Welcome to this very insightful and important webinar. My name is Oyinloluwa Alalade, and I will be moderating the webinar session for today. I'm so glad to have every one of you join us, those that are joining from Nigeria and even outside of Nigeria, and all the 36 states in Nigeria. Welcome, welcome, welcome. Today's webinar is a collaboration between the Nigeria Center for Disease Control and the Afrihealth for Social Development and Impact, ASDI. And what we are doing today is to have a major understanding of our advocacy, of how to apply the Lassa Fever Advocacy Toolkit. This, let me just say, I think you can react. You can just give a thumbs up if you can hear me. I'm referring to attendees now. Give me a thumbs up if you can hear me perfectly well. Okay, thank you. I can see that. Thank you. Okay, so as I was saying, we all know, maybe in Nigeria, that Lassa has been like a major public health challenge here in Nigeria. We have like recurrent outbreaks, and we have the main season, which is like the dry season, where we have higher cases of Lassa fever incidences being reported. Um, and also, Lassa fever preparedness or response to the outbreak is not a 1% approach. It's something that it has to be collaboratively done, and advocacy has to be done to some major key stakeholders that we have in our corners, in our states, in our LGAs. So the National Lassa Fever Technical Working Group, in collaboration with partners, developed this advocacy toolkit. And what we want to majorly do today is understand how this advocacy toolkit is and how we can even apply it. So this promises to be a very interesting webinar, a practical one, and it's not going to be just all talks. So once again, welcome to the webinar. Now I'll just quickly run through the agenda. We're going to have this opening and then welcome remarks from the Executive Director of the Afrihealth for Social Development and Impact. We'll then move into the technical sessions where we look at the advocacy concepts and frameworks, introduction to Lassa fever and the toolkit, advocacy strategies and practical applications, monitoring and evaluation of these advocacy plans, and then we'll also take questions and answers. This will be done in 1 hour, 30 minutes. So just stay tuned. And just in a bit of housekeeping, this session is currently being recorded. You can always send your chats to using the chat button you'll see chat button on your screen. You can always send responses to questions that are being asked there. And if you have your major questions that you want to ask to a particular panelist or you want to be answered live, just type also in the Q&A button that you see. If you click on the red button, it makes you exit the webinar. We want you to stay with us. So please, please don't click on the red button. Just stay tuned and enjoy the webinar as we proceed. I would invite the Executive Director of Afrihealth for Social Development and Impact, Dr. Yaya Disu, to just give a brief opening remarks before we proceed. Thank you very much. And over to you, Dr. Disu.
Okay, thank you, the moderator, for that wonderful opening session. And then I, on behalf of the Africa for Social Development and Impact, I want to welcome everybody to this webinar, which is the first in this series. It's very critical that we continue on the journey towards empowered and healthier community. And this is one of such efforts that drive us closer to that. I want to really appreciate the authorities of the Nigeria Center for Disease Control and then the leadership of the Technical Working Group for the hard work they have put in fighting against Lassa fever in the country. and also to continue to create awareness and sustain community engagement. And then we believe that this would further advance us in that direction. All the people who have worked hard from ASDI, Afrihealth, as well as from the government side and other partners, I want to say thank you for your hard work. I will say that it's important that we focus on this webinar to see what we can take away from it. And the effort is geared towards more or less at the subnational level. And I'm going to conclude with this. When it comes to resources, there are different categories in the community. One are those who control resources, those who attract resources, those who beg for resources, and those who demand uh, resources. Those who control resources are usually people who have power and influence and play some politics about it. Usually, you see government in this category. Those who attract resources are people like business class people who need skills, tools, and some intelligence to be able to create value and then market what they have and to bring people to demand for what they want, as in bring people to demand for what they have. And then those who demand for resources are when you get to civil society space, those who continue to advocate for the rights of the people, then this is what people need, and so on and so forth. And you need to do it. They quote all the conventions, all the laws, and so on. And the last is those who beg for resources. And then usually what is required here is poverty of the mind, lack of capacity, and then when people are in disadvantaged position, even people who sit on gold mine, you can imagine Africa, we have plenty of resources, but we still go to the Western world to go and beg for support. And they come and take our resources and refine it for us and send it back to us. So where do we want to be? I believe this webinar session will enable us to be in a position where we can attract resources and also, of course, talk to those who control the resources to be able to give what is desired or deserved by those who really need these resources. I want to say thank you and welcome you all to this webinar. Please let's pay attention and then ask next questions when it matters. Thank you and wish us all the best. Over.
Thank you very much, Dr. Disu, for that charge and brave opening remarks. That's highly appreciated. Um, I'll move on to just share what our objectives are for this webinar again. If you're a One Health stakeholder, you're in RCC, you're a program manager, you're a public health practitioner, this webinar is for you. And our objectives is to share practical advocacy approaches for engagement with diverse stakeholders, and also to provide tools and strategies that support multi-sectoral coordination and stronger outbreak readiness. And to help us achieve these objectives, we have some very powerful speakers that are on the call here with us. While I call them, they'll just say hello, and then they'll also turn on their videos so that you'll see who you're speaking with, and it's not just AI. I'll commence again with the Executive Director of Afrihealth for Social Development and Impact, Dr. Yaya Disu. Can you just say hello? Turn on your video, keep it on.
Okay. Hello, everybody.
Yeah, welcome, sir. I'll also move on to the Technical Advisor at Afrihealth for Social Development and Impact, also Dr. Olayinka Badmus. Can you say hello, ma'am?
Good morning. Nice to meet you, have you on this webinar. Thank you.
Thank you. Thank you for joining. I would also move on to invite the international development consultant that we have with us here on the call, Ms. Mayiwa Hede. Can you turn on your video and just say hello? Okay, while we are waiting for her, um, another powerful house, Miss Sarah Peter. She's the RCC focal person for the National Lassa Fever Technical Working Group. Miss Sarah Peter, can you please turn on your video and say hi?
Yeah, good morning, everyone. Nice having you with us. Thank you.
Good morning, Ms. Sarah. Um, Also, we have the lead of risk communication and community engagements at the Nigeria Center for Disease Control and Prevention here with us. Ms. Anatu Bello Hadria, can you kindly turn on your video, say hi to us.
Hi, everyone.
Hi, nice to have you here. Last but very, very powerful, the incidents manager of the National Lassa Fever Technical Working Group, and she's also okay, yeah, Dr. Yetunde Abioye. Can you just say hi to us?
Hi, good morning, everyone. Great to be here.
Good morning.
Looking forward to a
Good
fruitful
morning.
webinar.
Good morning, Dr. Yetunde. Welcome. Without further ado, we've taken 1 minute out of Dr. Olayinka's time. We'll move straight on to our first technical session. We'll be taking the advocacy concepts and frameworks, and this will be presented by Dr. Olayinka Badmos, who is the technical advisor at Afrihealth for Social Development and Impact. Dr. Olayinka, over to you, ma, for your presentation.
Thank you, Oyin. Please share the slides.
Okay.
So as the slides comes up, really thank you for joining us this morning. Can everyone confirm they can hear me loud and clear? I saw a brief internet is not stable. Can I get a thumbs up that you can hear me loud and clear?
We can hear you loud and clear, ma.
So this morning I'll be taking us through advocacy concepts and framework. It's kind of bringing us, key frameworks that helps us to understand how advocacy is done. In the chat box, if anybody wants to try and share with me what advocacy means to them, please go ahead and use the chat box to share. When you hear the word advocacy, what does that mean? I'm looking forward to your responses as I move forward. So next slide, please. So when we talk of advocacy, key things come to mind. One, advocacy is targeted. It's really targeted at people that have the power to act. Advocacy is strategic, intentional, and evidence-driven. It is aimed at influencing decision and systems, structures, and policy. It's really important that we know that advocacy is really more than speaking up. It's really deliberate and targeted. It helps us to focus on the why behind the problem. Next slide. We often confuse advocacy with courtesy visit. We see a lot of that when we go for rapid response, and we just see people doing courtesy visit and they are writing, we conducted advocacy. No doubt, courtesy visits are very important because they open the doors. It's really about protocol and relationship building. So you get into a state or you go anywhere, the first thing you need to do is what? Pay a courtesy visit. It's part of the protocol, it's expected of you. It helps you to show respect and establish goodwill. When you are doing courtesy visit, there's no specific request or policy ask. Whereas on the flip side, when it comes to advocacy, there's a clear, specific request. There's an ask. And your ask has to be evidence-driven and it really needs to be targeted. So we don't confuse courtesy visit with advocacy visit. Courtesy visit helps to open the door, and then advocacy walks through the door with evidence and a clear request. Next. Another key concept I want to compare is advocacy and lobbying. I've talked through advocacy in the previous slide, and I will just, again, re-emphasize some of the things advocacy aims to gain, which is what? Using evidence, relationship, communication, and coalition building, targeted at decision makers, and it's a broad effort to influence systems, policies, and decisions. On the flip side, lobbying is a form of advocacy. It is targeted at legislators and policymakers. It focuses on specific legislation and policy decisions. So when you're engaging with the lawmakers, it's now more of lobbying. Okay, so it's next slide. So all lobbying is advocacy, but not all advocacy is lobbying. And so why does advocacy matter? Systems will definitely not change on their own. Somebody needs to influence the system. And whether you're working on any form of, intervention, whether it's maternal health, whether it's community engagement, whether it's climate resilient, advocacy helps us to secure the decision that unlocks progress. It helps to create the enabling environment that drives political will, funding, policies, and action, and it is used across the continuum of systems. Next slide, please. I'm going to launch a poll. And I would like to get your feedback on my 3 questions. Please go ahead to launch the poll. So I have 3 questions. So please go ahead. The first question is, a civil society organization pays a formal visit to a community leader when starting work in the area. They present a small token and the leader expresses support for the activity. Please select, the answer. Is it an advocacy? Is it a courtesy visit? Is it lobbying? I'm hoping people have started engaging with the poll. The second question is, a representative from the Ministry of Health visits the local government chairman to request increased funding for health services, presenting data and proposing specific actions to be approved. Is that advocacy, courtesy visit, or lobbying? The question is, the Coalition of Education Advocates meets with a member of parliament to push for the passage of a bill mandating increased funding for STEM education ahead of a legislative vote. Is that advocacy, courtesy visit, or lobby? Can you confirm that
We have
response?
30 persons that have filled now, 28 persons that have filled now.
We really
28
love
out
to
of 60.
We really love to get your feedback, so we give it additional 30 seconds to engage with the 3 questions on the poll. When we reach about 35, you can move forward to the next slide.
Okay.
Okay. So just like anything we do, there needs to be a guiding principle, a framework that allows us to be able to implement. That's not set up for advocacy. A framework, helps us to think clearly, act strategically, and then deliberately. When we have complex problems, frameworks helps us to be able to get down into that allows us to take action. So frameworks helps us to move from intention to action and make sure our advocacy is strategic and not reactive. So next slide, please. Okay, so for advocacy that we're talking about today, I'm proposing 3 frameworks. We have the CLARE framework that helps us to strengthen how advocacy is carried out. And then we have the SMART advocacy, which helps us to sharpen what the advocacy axis, and then the socio-ecological model helps us to identify where the intervention happen. Most times, we use frameworks as complementary approaches, to make things a bit stronger. The Lassa Fever Advocacy Toolkit, which is the core of this webinar, explores the SMART advocacy and the socio-ecological model in slide. I'll touch briefly on the CLARE framework. Next slide, please. So CLARE framework looks at collaborative, it helps us to remember that advocacy is rarely done alone. It works best when we collaborate. Again, across the One Health sector for things like Lassa fever, collaboration is very important. It helps us to be coalition and allies. It focuses on the L is leverage, who are you asking, who has access, who has credibility, and so you leverage existing influence. It also insists on evidence. Advocacy without an evidence is just an opinion. Evidence makes our case more credible and persuasive. And then the A itself is the advocacy, that clear intentional action directed at a decision maker with authority to act. I will say again, at a decision maker with authority to act. And finally, the result, this reminds us that advocacy is not complete until there's a measurable outcome. And Sarah will speak more on what we use to measure outcome. The SMART advocacy. Next slide, please. Okay, so the second framework is SMART advocacy, and the core principles around SMART advocacy is it helps you to identify the right decision maker, it helps to clarify the right acts, and then it focuses on near-term advocacy win. We all know the acronym SMART: specific, measurable, achievable, relevant, and time-bound. There's a particular framework. Next slide, please. The 9-step SMART advocacy circle. This particular SMART advocacy circle, it's a 3-day training that guides participants on really going through these 9 steps and developing an advocacy plan, and then your monitoring and evaluation plan. The 9 steps is divided into 3 phases. One is around Phase 1, building consensus. You need to understand the landscape. You need to know who to engage with, who to involve in your advocacy act, and then a SMART objective. A key area that I really love is the Phase 2, when you focus your effort. You need to understand your decision maker. You need to determine your acts, and then you create a work plan. Where we make a mistake is usually knowing the decision maker. Knowing the decision maker helps you better to know if your advocacy will work or not. There might be people, yes, I'm the head of the unit, does not make you the decision maker. I am, by virtue of, you might also not be the right person to channel that, the complaints forward. So aside building consensus, focusing on effort, the Phase 3 is achieve change. And this helps us remember that, apart from presenting your case, monitoring the plan, and capturing response, the key thing about advocacy, when you look at the circle, is that advocacy is not one-off activity. That's why it's a circle. It's a continuous circle where you continue to assess the landscape, identify the opportunities, target the right people, and work towards an achievable win. This allows us to learn and improve. Advocacy, if there's anything you're taking away, advocacy is never one-off. It is an iterative process you continue to build on. And smart advocacy helps you to be targeted. It focuses on a specific ask. You can't go to a decision maker with 10 asks. You need to bring your bottom line up front. What are you looking out for? Next slide, please. Okay. The socio-ecological model is also a key thing we use, letting you understand where do you focus your influence on. Advocacy is strongest at policy and institutional level. You shouldn't be doing advocacy at individual, interpersonal, or community. It really depends on the context. Again, advocacy is targeted, advocacy is evidence-driven, and advocacy is focused on the decision maker. Next, please. As you talk through advocacy, you also need to understand that there's a process. So there's awareness to understanding. You are aware of the issue, you have visited, you have told them the issue, but do they understand the issue in the way you need to make them understand? When you're able to get your policymaker or your decision maker to understand, the next is, how do you engage? What's the best channel and engagement process for that decision maker? And then what's your commitment? What's the commitment or action the person needs to take? It needs to be clearly stated and before you see any form of change. So there's a communication chain when it comes to advocacy. Next. Still on the decision, depending on who your decision, the channel and the mode of communication also varies. So when you're to a policymaker, there are key things you need to include in communication, like impact. There's a difference between when you're talking to a technical person and you say, oh, maternal mortality is, 570 life births per 1,000. Your policymaker can't understand that. If you're able to, in this country, 1 in 5 mothers die giving birth, every day, again, explaining your neonatal mortality. So it's really clear, right? Depending on your audience. So for the policymaker, you need to show them the impact of not acting now. You also need to include what's the cost implication of what you're trying to tell me to do. And then you use channels like policy briefs, policy dialogue session, you use opinion ads. The public deals better with human angle stories. You want to see visible action, and then you use the channels that is most appropriate. If you're using social media, by the time the thing is more than 3 minutes, you have lost the attention span. Again, radio, within your 60 seconds, you can't jump. Radio drama, whatever it is you're trying to communicate. Whichever audience, you need to know what information you need to add to your content and then the appropriate channel to use to advocate. Next slide, please. So as we come closer to the end of my session, I need you to understand that advocacy frameworks are context neutral. That means they can be applied in any setting. Advocacy is not left for maternal health or, again, within a public health emergency. Within policy reform governance, advocacy is necessary. What changes is the approach when you use a strategic understand the landscape, who are you going to collaborate with? So all those frameworks work, whether it's a clear framework, whether it's the smart advocacy, whether it's ecological model framework, it's just the issue that changes. Next. So what's my key message to you? It's strategic influence, and it doesn't stop on awareness. There's a process to advocacy. There's a plan that you need to draw, and then you need to monitor your advocacy. great. They help us to build relationship, but advocacy drives the decision. You need to move from CVC to identify your what, when, why, and how. The clear framework strengthens how advocacy is carried out. It's again, it's collaborative. You leverage on existing structure system that you can. It uses evidence. Your advocacy acts needs to be clear, and you monitor. The same thing for the smart advocacy cycle. Steps 1 to 9 with 3 phases. What to ask and from whom. The socio-ecological model that identifies the different layers of strata helps us to identify where to intervene for maximum impact. And as I mentioned, these frameworks apply across any public health or development context. Next slide. Thank you very much. And I hand it back over to the moderator. Over to you, Oyin.
Thank you very much for that beautiful presentation, Dr. Olayinka. I can see that some questions are already coming for you. We'll take them during the Q&A session. Or you could also type your answers live. We'll read it when it gets to the Q&A also. But thank you for the summary slide. And another thing I want to add, like she mentioned, is advocacy is focused on the decision makers. And in the next 5 minutes, we'll have the lead of risk communication and community engagement, Ms. Anatu Bello, take us quickly of an overview of the Lassa Fever Advocacy Toolkit. Anatu, are you ready for us?
Yes, please.
Okay.
Yes. Can I have the slides?
Okay, minutes.
I could start talking anyway before you get it up if you want that.
It's up now. Can you say it?
Yes, all right. Good morning, everyone. Like we said, this webinar is all about getting us all hands on board in order to get everyone involved that needs to do what we need to do in order to combat the menace of Lassa fever in our communities. Next slide, please. So I'll be taking us through and I will be introducing us to the Lassa Fever Toolkit. We all know that Lassa fever is an acute viral hemorrhagic illness, which was discovered, of course, in the 1969 in a Lassa village, in the Lassa village of Borno State of Nigeria. It is now endemic because some other African countries like Liberia, Sierra Leone, Guinea, other than Nigeria, are also experiencing the outbreaks. However, this menace or the Lassa fever pandemic is transmitted through contact with a mastomys rat excreta or of an infected mastomys rat through their body fluids, and of course those that are highly at risk are people in rural areas and our healthcare providers. The burden and impacts of these include about 300,000 to 500,000 cases per year in the West African zone. According to the WHO, the overall case fatality is at 1% up to 15% in severe cases, but in Nigeria it is about 3 to 42%, as a result of which we have causes for hospital admissions, maternal deaths, and of course we are now experiencing seasonal outbreaks. In those days, it used to be certain period of the year, but we know that we now have a period of the year that is at its peak, while we experience it almost throughout the year. And how do we prevent this from happening? We've observed over the years that most of the time people are very low on personal and environmental hygiene. Rodent control is not at its best. Early detection is also an issue. Our observation of IPC at hospital settings are also some of the issues that, if observed properly, could help us in the prevention. Surveillance, public education, treatments availability at the hospital settings could also help, while the NCDC coordinates multi-level response with international and local partners like WHO and other partners. Prevention could be at least take us somewhere. Next slide. So, the toolkit itself. Hello, next slide, please. Can you hear me? All right, thank you. So the Lassa Fever Advocacy Toolkit, what it is and why does it matter? It's actually a living advocacy toolkit for Lassa fever preparedness and response. Dr. Olainka touched on what advocacy is and all of what we can do to get the best out of this. You know, the development through a multi-sectoral One Health collaboration, a lot of partners, sectors were involved in this. It is evidence-based. The use of epidemiological data, behavioral insights, and after-action review, which are all the things we need in order to have a proper and impactful advocacy. It is also structured to guide advocacy at policy, organizational, and community levels, which are all those levels that are in our socio-ecological model. And of course, why does it matter? It moves RCC from awareness to system-level advocacy, targeting decision makers. We agree that advocacy should not stop just at awareness. We need to take it to the next level. You know, it also supports Nigeria's goal of reducing Lassa fever case fatality to less than 10%. It helps to prioritize resources, policies, and interventions for greater impact. And it is adaptable for other priority diseases. Like Dr. Olainka said, we can now use this particular toolkit, adapt it for other priority diseases that are also problematic to us in Nigeria, such as cholera, mpox, diphtheria, CSM, etc. And then, of course, the socio-ecological model, using communication frameworks to drive change. The socio-ecological model is a communication and advocacy framework showing that behavior change is shaped by multiple interconnected levels. You know, we have several levels, from personal to the policy level. It recognizes that individual actions are influenced by policies, institutions, and social systems used in this toolkit to structure advocacy, planning, and action, not just messaging. So why is the socio-ecological model? Why does the socio-ecological model matters for Lassa fever advocacy? It is because it is sustainable behavior change, requires positive policies, systems, and community structure. Advocacy focuses on where decision-making power exists. So even though there are several levels to target, but we know that the decision maker is the one that will eventually give us the desired stance that we need. Policy, leadership, laws, funding, preparedness are very key. At organizational level, the health facilities, diagnostic, our functional laboratories, observation of standard infection prevention and control measures at the hospital settings and workforce instances. At the community level, trusted actors for early detection and referral, because we also want early presentation at the health facilities for management. These levels enable effective social behavioral change, risk communication, and social mobilization at interpersonal and individual level. So we have additional resources such as the Viral Hemorrhagic Fever Quick Reference Guide are as follows. Please let us endeavor to engage all of these for more information, more clarity, and more knowledge. Thank you very much. Hello,
Thank you. Can you hear me?
Yes, I can hear you.
Yeah. Thank you, Dr. Anatsu, for that. Someone has also requested if they'll be able to have access to these slides where they would also have the resources. It's going to be shared. The presentation slides will be shared. And I
Yes,
also
please.
got a notification that participants are unable to type in the chat box. We'll take a look at that and also try to resolve that as soon as we can while we're in the meeting. Okay, moving on now. We'll be going into the overview of the Lassa Fever Advocacy Toolkit again by sorry, I just want to share this agenda. Okay. So we'll be calling on the Mrs. Meiwa Ede. She's going to be taking us through these advocacy strategies and also like practical applications, taking us in depth into the Lassa Fever Advocacy Toolkit itself. So Ms. Meiwa Ede she's an international development consultant, and I'll just bring her up on board now to take over and also present her slides. Thank you.
Thank you, Oni. Good morning, everyone. Please, can you hear me? Am I audible?
Yes, you're audible.
Okay. Please, Oni, could you go ahead and share my slides quickly? So thank you to the previous speakers, Dr. Olainka and Hanatu, for the great work they've done. I think they've made my work a lot easier because they've said a lot of what is the foundation for what I'm going to be talking about today. Earlier this year, the government and partners and generally stakeholders came together to prepare an advocacy toolkit that will help anybody go into the field with resources to be able to talk to certain decision makers, which Dr. Olainka referred to earlier, about Lassa fever and advocating for the results that we want to see. It took a lot of time and effort to validate this document, and what we're going to be doing here is sharing overview of this document and how it can be used. Next slide, please, Oyin. Okay, so basically, this is what the document looks like. I assume everybody has been able to get a copy of this just to kind of familiarize yourself with it. It's a resource designed to support efforts in raising awareness around Lassa fever. But just like Hanatu said a moment ago, while it was developed for Lassa fever, it is able to be used for other diseases because the principles for advocacy are the same across board. While this was developed for Lassa fever, if you apply the principles, you can use it for other diseases as well. Overarching goal for Lassa fever for Nigeria is to reduce the CFR to below 10%. It is advised that advocacy teams where they can be developed jointly come together, brainstorm on the commitment issues, and take this toolkit and use it as a resource to make the necessary advocacy to the decision makers. Next slide, please. Okay, so this toolkit has 3 sections and an annex. So basically, this is an overview of what the 3 sections look like. The section 1 is about introduction. So if somebody picks up this toolkit and doesn't know anything about Lassa fever or anything about advocacy, the toolkit will be able to guide you through everything or most things you need to know, where you need to go for more information, and what you need to be able to do to talk to the decision maker about Lassa fever. So section 1 is giving you background information about Lassa fever, definitions in the toolkit, talking to you about the SEM model, the socio-ecological model that Dr. Lainka referred to earlier, talking to you about your advocacy strategy and identifying the targets that you should be identifying at the different socio-ecological models. The second section is a guide on the advocacy strategies to apply. Dr. Lainka talked a bit about that earlier. So section 2 will give you a bit more information about the advocacy strategies you should apply for Lassa fever specifically, focusing on the overarching goal because we want to advocate for Lassa fever for the country. So it's not a personal passion project. While that is good, we have to tie it to what the country needs. And the country's goal is to reduce CFR by 10%. Next slide, please. Oh, yeah, okay, thank you. Section 3 will give you resources on frequently asked questions. So for instance, if you go to a decision maker and they ask you questions, you can always refer back to the advocacy toolkit. If you send an advocacy email and you get back questions on some things they don't understand, the toolkit has frequently asked questions that you can use to respond. It has resources, you can go for more information. It has a checklist that you can use. So even before you go out on your advocacy visits, you can use the checklist to check whether you and your team are prepared for this advocacy that you're about to go to. Finally, it has annexes that contain advocacy briefs. So I think Dr. Lenka mentioned it earlier. So if you're going to a decision maker with an advocacy ask, it is important that you go with a leave behind, what we call an advocacy brief, where you talk briefly about the advocacy issues, your needs, the strategic goals, and the evidence and all of that. So that advocacy brief, we have samples in the toolkit that can either be printed out, they can be cut out. It's a cut out document. You can cut it out, or you can adapt it for future use or for other diseases. So these are the 4 sections of the toolkit. Next slide, please. Yeah, next slide. So basically, we're now going to go, Dr. Lenka talked about the socio-ecological model. Now, when it comes to proper smart advocacy, we are going to focus on the top 3 levels, which are the policy level, institutional level, and community level, because those are the 3 levels you can really apply smart advocacy. For the other 2 levels below, you would apply other communication strategies such as peer education, interpersonal communications, and stuff like that. You may not be able to apply smart advocacy at the individual level and at the family level. I hope we understand that, but we can talk more about that later if it's not well understood. Next slide, please, Oyin. So what is our collective goal? Our collective goal is that through coordinated advocacy, we strengthen our systems, improve coordination, save lives, and reduce our CFR to below 10%. That means we want the number of cases that appear at facilities and end up in a fatality to be below 10% for every outbreak, for Lassa fever. Since we know that Lassa fever is endemic in Nigeria, we know that over 24 states are currently affected by Lassa fever outbreaks. We have a CFR presently, I think the last, as at November, it was about 18.1%. So it's between 18.1 and 17.9% presently. What we need is 100% commitment from all stakeholders at all levels, multi-sectoral, multi-partner, to be able to commit to this overarching goal at the national, state, and local level. Next slide, please. Now, I talked about it earlier, how we are going to focus on 3 strategic advocacy levels for these toolkits, right? We're going to focus on the policy level. That means the state government and the policies they make that affect the ability of people to either report to the facilities or affect the ability of states to respond to the Lassa fever outbreak in their states, to secure emergency health funds for the period of emergencies. We're going to respond to organizational level. At this stage, we're going to be directing our advocacy to health facilities. And who is the decision maker in health facilities? Typically, it's the chief medical director. That means the chief medical director is the one that is able to make the decisions that can expand the diagnostic services, that can make the decisions to train personnel, that can make the decisions to ensure that laboratories are standard, that can make decisions to ensure that PPE is available, that can make decisions to ensure that their personnel is well equipped to manage Lassa fever cases if and when they do appear. At the community level, we targeted PPMVs, patent and proprietary medicine vendors, because we understand that at the community level, the PPMVs are the first port of call for anybody that falls ill, any illness of any kind. If people want to do self-medication, where do they go to first? They go to the PPMVs. So what do we need to do? We need to advocate to these PPMVs so that they can also increase their index of suspicion and also improve referral. So when you see somebody with a fever, don't just give the person malaria medication. Don't just give the person paracetamol. Ensure that you have a good understanding of the Lassa fever dynamics in your community and refer them when you can. Strengthen community level decision, strengthen community partnerships so that people are able to report to the facilities in good time. Next slide, please. Yeah, so at the state level, at the policy level, typically we would want to address the governor, but in other cases, we can address the commissioners for health, depending on who we see. Remember, Dr. Lainka had said it's about decision maker. We need to sit down as a team and workshop between ourselves, at the community level or state level or wherever, workshop between ourselves and brainstorm on who is the key decision maker, who holds the button. Think of it as if you've watched action movies before and you're saying that the president needs to press a red button to declare war on another state. Who holds the power to push that red button? That is who you should be targeting, right? Think about it. And also for your checklist, you need to have the state data. That means you need to keep an eye on the epidemiological data that is in your state. You need your state EPID in the advocacy team. You need him to be a part of the advocacy team, or her to be a part of the advocacy team. You need to map your decision makers and influencers, because sometimes the decision maker is not necessarily the influencer. There may be somebody that you can target that can get you to the decision maker. You need to be able to map those people out as well. You need to prepare your policy brief, your advocacy brief with the asks, because you cannot just ask them to do something. You need to give them an idea of what the budget would include, if there is any. So if you tell the state governor to begin to include emergency health funds, what amount are we looking at? What percentage of the budget is this going to take? Then you need to also begin to think about to secure a meeting with the relevant commissioner, governor, or whoever is the major decision maker. You need to have your key messages in place. What are your key messages? Keep it short, keep it simple, keep it easy to understand, evidence-based all the time, right? If you reference Annex 4.1 in the advocacy toolkit, you can get more details on state ownership, situational analysis that we developed together for the state level advocacy. Next slide, please. Yeah, at the organizational level, and this time we're talking about health facilities, our primary targets that we thought about, and again, this list is not exhaustive, I would like to note here that this advocacy toolkit is a living document, is an evolutionary document. That means as we use it, as we learn from it, we continue to reiterate the development of the advocacy toolkit. So for us, we looked at it, and some of the instances that we looked at, the primary targets or the key decision makers could be the chief medical director, it could be the director of administration, it could be the head of lab, head of emergency, all the like. As an advocacy team, you need to come together and map that out for yourselves. What is our advocacy guidance for health facilities? We need to focus on operational improvements within the facilities to prevent infection control, to protect the healthcare workers within those facilities, to emphasize enhanced facilities within enhanced diagnostics within the facilities. You need to be able to link your request to key performance indicators. What is important to these chief medical directors? Their bottom line. What is important to them? Customer service. They want returning customers. They want customers to know that we care. Focus on those and link your request to those things that are important to the decision makers. You have your strategic checklist. Again, you need to assess the current diagnostic capacity within that facility. You need to know their turnaround times. You need to understand their IPC supply stockouts, because this is how you are able to advocate properly with evidence when you are talking to them. You need to also give them an idea of what it will cost to implement some of the recommended measures you're going to be giving to them. So it's advocacy is not just something you wake up and say, okay, we have entered this day, let's just go to the facility and talk to the person. Dr. Lainka told us between courtesy visits and advocacy. Advocacy visits, you have to come correct, you have to come with evidence, you have to come with budgets and implementation plans, all of that, right? You can reference the advocacy strategy for health facilities in Annex 4.2 in the advocacy toolkit. Next slide, please. So at the community level, the strategy is different because we're talking to patent proprietary. Sorry, I always mix that up. We're talking to proprietary patent medicine vendors. Yes, we're talking to PPMVs. So first of all, what do you have to do? You have to identify your target PPMVs. That means that you must understand how many registered PPMVs are in the States. They usually have a body. You may need to go to the body and start your advocacy with them, right? You may need to build a relationship with them. So that means you will start with a courtesy visit. Go to them, say hi to them, tell them why you're here, tell them what your mission is, why it's important, right? Start with courtesy visits. And over time, you may need to develop such a relationship with them that you're able to build their capacity to improve their index of suspicion, because a lot of them simply do not have that capacity. And if they don't have the capacity, they cannot give you what they don't have. So there might be a need to deliver some sort of training or sensitization for them so that they're able to increase their index of suspicion, just like we need them to do. You may need to supply them with job aids, reference materials, a fever algorithm, things that can help them deliver better care to their customers, not just your need, not just your advocacy requirement. You also need to establish feedback systems with them such that they can institute referrals, right? So if they want to refer, who do they need to talk to? If they have questions, who can they ask? You need to establish feedback systems with them. Let us remember that PPMVs are the first port of call for most people within the community. So excluding them from our advocacy is going to be a very big missed opportunity. For more strategies on engaging community level PPMVs, you can reference Annex 4.3 on the toolkit. So basically, these are the 3 levels of advocacy that we will focus on because they are the 3 higher levels, and we have resources that Sarah will tell us more about within the advocacy toolkit. Next slide, please. So we're going to do a quick quiz, and I hope people have access to the chats. Oh yeah, I think I would need your help for this.
Yes,
Next
Professor.
slide. Next slide, please. Great. So the quiz is called Sports the Advocacy Power Move, right? Dr. Anato has talked about the situation. Lassa fever is endemic to West Africa. Nigeria bears the highest burden globally. We have 300,000 to 500,000 cases regionally, across West Africa. So there is a big burden for Lassa fever in the region, and Nigeria bears the highest burden. I think up to 70%, if I'm correct. Forgive my numbers. Dr. Yetunde can help me address that. What are our key challenges around Lassa fever? Poor environmental sanitation in communities, waste management in communities, late presentation to health facilities, limited awareness of Lassa fever, delays to treatment, low suspicion among health workers, because a lot of the time when people appear in facilities, health workers do not immediately think of Lassa fever, except they're used to Lassa fever in their community. So stuff like that results in misdiagnosis, which increase the fatality rate for Lassa fever. Also, there's the absence of a licensed vaccine, which limits primary prevention options. These are the major challenges for Lassa fever in our country. Our transmission rate is mostly 20% human to human, 80% rodent to human. I think it's less than 20% now, if I'm correct, human to human transmission. Case fatality is still between 15 and 20%, even within the hospital setting. So that means there is a huge problem going on. Key recommendations include rodent control, early surveillance, which happen to be highly effective and cost saving. So if you prevent it, you can protect people from Lassa fever in the first place. Let us remember that when it comes to advocacy, the messaging principles are: you must have a clear, specific ask, measurable outcomes, and evidence-based reason. If you don't remember anything I've said today, please remember these three. You must have a clear, specific ask, you must have a measurable outcome, and you must have evidence-based reason. Next slide. Now, based on the situation in the previous slide, we want to develop an advocacy message. I have two versions I've developed. Version A: Lassa fever is a serious disease in our country. It affects many people and causes deaths. We need the government to do more about it. So you go to the Ministry of Health and you see the commissioner or the governor or whoever you're seeing, and you tell them, Lassa fever is a serious disease in our country. It affects many people and causes deaths. We need the government to do more about it. You're passionate. You go with, all the passion, the strong team, strong people, and you present this message to them. That's version 1. Version 2, you present this to them. We urge the Ministry of Health to invest in community-based rodent control and integrated surveillance systems in order to reduce Lassa fever transmission by up to 80% and prevent thousands of deaths annually, because evidence from endemic regions shows that these interventions are cost-effective and have lowered outbreak costs by millions. Somebody says they can't see the slides. Please, can I confirm that you're seeing the slides?
Yes, I can see the slide.
Okay, great. So these are two versions of messages. So what I want people to do in the chat is, which version do you think is stronger and what makes it so? So quickly just drop 1 to 3 keywords or phrases in the chat box that makes the version that you say is stronger so. Quickly, please. I think Oyin has given me just how many minutes left. Version B, somebody says it's evidence-based. Version B because it's smart. Somebody says version B, it has details. Okay, these are great. Yeah, version B because it's measurable. Great. Somebody said we can't see the slides. Don't worry, I'm sure the slides will be shared. It's evidence-based. 80% shows impact and the ask is clear. Shows the cost, the burden, solutions, all of that. Thank you so much. Oyin, can you please go to the next slide quickly so that we can confirm whether version B is the stronger one? Yes, version B is stronger, and I've highlighted some of the things that makes version B stronger. We have, what is the specific ask? We want you to invest in community-based rodent control and integrated surveillance system. We have expected impact. It will reduce Lassa fever transmission by up to 80%. We have evidence, and data from other endemic regions that show that they've done these interventions. It is cost effective and it has lowered outbreak cost. So remember what I said in the previous slide, the message specifics. It has to have a specific ask, it has to have evidence, and it has to have what the impact will be and the cost will be. Next slide, please. So, key takeaways for advocacy, for your advocacy. Design specific measurable advocacy objectives, targeting decision makers who control resources and policies for Lassa fever control. And this could be applied to any other disease you're advocating for. Use the socio-ecological model to know who to target and how to target them. Customize with local evidence. Work with your state EPID. Work with the epidemiological data for your region. Leverage the toolkit as a living document. There are lots of resources there to help you. There are numbers you can call. Share your lessons. Share your learnings for future iterations. And finally, I would expect all the advocacy teams to commit to one advocacy activity from today's training that you will implement in the next 30 days. Why? Because if you don't implement this now, if you don't use what you have learned, you will forget it. If you've known anything about trainings and learnings, there's a forgetting curve. And if you don't use this within the next 30 days, you will forget it. Document your approach, document your learnings, document your outcomes. Remember that advocacy is not a one-time, one-touch process. It's a process, so it takes time. Thank you so much. I think that's my last slide. Thank you, everyone, and enjoy the rest of your session. Over and out.
Thank you, Meiwa, for that wonderful presentation. I can see some questions already in the chat box, and Dr. Yetunde will be taking over from me here to moderate that.
All right, thank you so much, Oyi. Wonderful presentation so far, and it's been so beautiful from every one of our speakers. Yes, so we have 5 questions that are still left open. Okay, so let me say about 4. And I don't know, Dr. Lainka is not here. Dr. Disu, would you be happy to answer a question on our behalf?
Oh, sure.
All right,
Sure,
thank you so
glad to
much,
do.
sir. So the question says, thank you, Dr. Lainka. I'm passionate about health advocacy. I make videos on public health issues, zoonotic disease, hepatitis, etc., to make the public more informed. The risk factors and preventive measures as well. Is that advocacy too?
Sorry, come again what you read last. There was some fluctuation. Quickly.
Okay, sorry. So there's a question about health advocacy, right? Maybe Onyi can also add a bit, because I see she had requested to also answer this live, but I thought maybe to direct it to
No,
you.
I said repeat the question. Just repeat that question. I stopped hearing you at some point. So that's why I
Can
said
you hear
just
me
repeat it.
now? Can you hear me
Yes,
now?
I can hear you now. I can hear you now.
Okay. It says, I'm passionate about health advocacy. I make videos on public health issues, zoonotic diseases, hepatitis, etc., to make the public more informed. The risk factors and preventive measure, is that advocacy too?
That's more or less an awareness creation and talking about the risk, right? And for what people need to do to protect themselves. That's not advocacy. Dr. Layenka clarified that in her presentation. I think this lady also re-emphasized that Meiwa, that is targeted towards the people, decision makers, policy makers, right? And then in order for them to invest or release resources or provide enabling environment for people who implement interventions to be able to do their work effectively and to ensure that all the resources are available for us to work. But if you are creating an awareness video about for the public and what to do, that's more like awareness creation and promoting attitude change or behavior change towards this. That is not advocacy, but it's more like a public public engagement or sensitization and so on. Thank you.
All right, thank you so much. Onyi, do you want to add anything to that?
No,
Okay,
no,
Yes,
that's
thank you so
fine.
much.
Mayua has her hands raised.
Oh,
Okay,
okay.
okay, over to you, Meiwa.
Yes, thank you so much, Dr. Diso. I just wanted to add also that all of this, what Dr. Diso just mentioned, what you're doing in public, creating awareness, raising awareness, public sensitizations, talking to people, along with advocacy, along with even the courtesy visits, all of that work together to get us towards the overall goal, right? So everybody has a role to play. You might not be part of the advocacy team, but what are you doing in your own little space? Who are you talking to? How are you raising awareness? All of this contributes. Remember what I said, at the two lower levels of this SCM model, at the individual level and at the family level, you can also play your part with behavior change by creating that awareness that you're doing by interpersonal communication and the like. Over.
All right,
Yesterday,
thank you so much.
just to add a little bit, um, those who create awareness about the risk and what people need to do will also promote indirect advocacy by instilling, inciting the public to generate demand from the authorities or policymakers to do something about this. So they could be done indirectly, especially when you are doing that through the media. Media can talk to the public and let the public demand for this support for these initiatives or efforts. So it can also it can contribute to it, but that is not a real advocacy, but it could be part of efforts geared towards advocacy either directly or indirectly. Thank you, Anuva.
All right, thank you so much. So there is one question here, and it says from Alexandra, do you think courtesy visit can be combined with advocacy, considering the context of the country, Nigeria? I would like to direct this to Onyi. Or Dr. Disu.
Okay, if Oyin is having issues with network, okay,
I
Oyin,
just
go
needed
ahead.
to get back. Yeah, I needed to get back to. Yeah, I said, do you think court services can be combined with advocacy, considering the context of the country, Nigeria? So Dr. Lankard initially said, advocacy, you have a key ask. So if you are going for courtesy visit, it's more you are going to visit the persons to say, oh, we are here. You are not really going for an ask. So it's either you're going for advocacy or you're going for a courtesy visit. Advocacy
Okay.
has some components of the courtesy visit because you're definitely going to visit the person, but courtesy visit is not advocacy. I hope that answers your question. Thank you.
Thank you so much. So I see there are
To
a
add
couple
to
of
that,
more.
yesterday, I think the person is asking if we can combine the two together. The reason why I feel where the person might be saying that is because there may not be opportunity again to see these influential persons. So, like, okay, we're playing courtesy visit. Can we also have the ask rate? Yes, it will be with a risk because courtesy visits will also dilute your power of advocacy. So it depends on the context, right? And then how you can be very flexible about this. You know, it's because if somebody is just, for instance, appointed to be in power, to be a minister or whatever, we say, oh, let's say we're here. But you also see that, oh, there is a problem that you want him to focus on. So you can combine this, right? But just distribute your time. That you know that first and foremost, hey, we're here, but now make sure that your message is very clear, as in applying the skill sets and the use of tools you have gotten from advocacy. So in
All
there are
right.
situations where that can be done. Thank you.
All right. Thank you, sir. So I think because of time, we are really, really pressed for time, so I will have to limit the responses to just one person per question. So the next question here, Mayo, I don't know if you would like to answer this. They said answers to the initial poll have not been shared. Kindly show the difference between courtesy visit, lobbying, and advocacy. I think there was a lot of interest in this Dr. Olayinka's presentation. I really wish she was here too. But I think at the end of the poll, they wanted to see the answers to those questions. So if you can quickly go through that, but if not, we can just skip for now. Maybe Onyi will help with that later.
If I may respond to that, yes, I'll share the
Okay,
polls.
thank you.
I'll share it after Sarah's presentation.
Oh, great. Okay, thank
Yeah.
you. So that's already been done. So there is also a question here. I'm unsure about this one. Maybe Haji Anatu could speak on this. It said, hello everyone, concerning the NCDC Lassa Fever Learning Advocacy Program set to begin next year, is the application still open to medical students? I'm unsure about this, but I don't know if Haji Anatu has any response to this.
Sorry, what's the question again? I didn't get it.
Okay, so the person was asking that concerning the NCDC Lassa Fever Learning Advocacy Program, which I'm not aware of, but the person said, I don't know where they got the information from. So NCDC Lassa Fever Learning or Advocacy Program set to begin next year. Is the application still open to medical students? I don't know if this was mentioned because of the presentation.
I don't know too, so I've not heard of this. I don't know. Sarah, are you aware of this? Otherwise, we'll try to find out and maybe kind of get back to the person. I
No,
don't
Okay,
know.
ma'am,
thank you so
I'm
much.
not aware of this also.
So I
Okay,
don't know.
okay, thank you so much, ma'am. I'm just trying to quickly see. Okay, so there is a question here that says, to what extent does passion drive successful advocacy compared to political will? And this is from Jude Okorafor. To what extent does passion drive successful advocacy compared to political will? I think after this, we have one more. So, Mewa, would you like to respond to this? To what extent does passion drive successful advocacy compared to political will?
Thank you so much. That's a very good question. There's a difference between passion and political will when it comes to the decision maker. But what advocacy does to you is it presents sort of like a cost-benefit analysis so that you are able to match both the passion and the political will and kind of merge it together. Find out what the decision maker is passionate about. Find out where their mandate lies and tie your advocacy to that passion and that mandate. Every politician, every decision maker has something that drives them, a value they are gunning for. Look for that value and tie your advocacy to that value. Do some sort of cost-benefit analysis and use that to drive your advocacy. So yes, passion is important, political will is important, and if you are very strategic in your advocacy, you'll be able to marry both.
Okay. All right, thank you so much. Sorry, I don't know if you can hear me. Can anybody hear me, please?
Yes, please.
Yes.
Okay. Yes. So just there's a question here. Sorry, I keep getting interrupted, my network. Yes, so it says, Oyi, please, I don't know if you'd like to answer this. What are the epidemiological nature of the prevalence of Lassa fever outbreak among the population and the way to mitigate it?
Okay, so Dr. Olayinka is back online. We might want to direct that to her.
I hope you're not just putting her on the spot.
No, I'm not putting her on the spot. We might or do we take Sarah's presentation and then come back to that question?
Okay, because of time, right? Okay.
Yes, because of time, please.
All right. All right, so we'll come
Thank
back
you.
to that. Thank you so much.
Thank you. In the meantime, that also can be answered in the chat. Sarah, over to you, please.
Thank you so much, Oye. So I'll be taking us through the monitor and evaluation for the smart advocacy. So you've already know what the smart advocacy is. You've already done your smart advocacy. So how do you now monitor and evaluate the impacts of your smart advocacy? Next slide. Okay, so why M&E matters in advocacy? So, like we know, if we don't track what we do, we'll confuse our effort and our impact at the end of the day. So that's why it's key for you to always monitor and evaluate your advocacy. Number one reason why we do that is that we need to avoid confusing our activity with our impact. You've done activity, but what impact have that activity yielded? So number two is to show what is working and what isn't working in your strategy, and then you can help adjust what is not working. So it helps us to like go back to the drawing board when we have an issue, help us to monitor how far we've gone, and then if we need to go back to the drawing board to redesign some of our approaches or our strategies. Number three, that is help us to build credibility with our partners and policymakers. Because you are monitoring what you're doing, it's kind of sees that, okay, you know what you're doing, and this is how you're improving on what you're doing. And number four, which is the last, it helps us to move our advocacy from noise to influence. So when you monitor, you know where you have gaps and where you need to adjust, and then how you need to put in more effort in addressing that gap that will help you to move to influence. Next slide. So what do we need to monitor in advocacy? Number one, you need to monitor the change. So to monitor this, your advocacy, we have three different layers. I don't know if you can do the next so that everything should. So we have the advocacy changes in three layers that we need to monitor. Number one, you need to monitor the process. What did you do? What are the things that you've done that you need to look at how far you've done them? And then the second one is for you to monitor the outcome. What have changed after you've done all your activities? What have changed from where you are and where you are, from where you've been and where you are recently. And then the last one is for you to monitor the impact. What has this your change led to? Have it led to change of maybe change of policy? Have it led to change of behaviors? Or what have your advocacy led to over time? Next slide. So for smart advocacy framework, so we have the three process that we are monitoring. Number one is the process monitoring, and this is short-term activities indicator. So you are monitoring your activities and seeing how far you've gone. So one of the key questions that you need to ask is, are we implementing our advocacy plan as intended? So you need to ask yourself that question. And this will help you to track your advocacy action and output. Like if you've had meetings with your decision makers, maybe you've developed policy brief, you submitted, or you've done media engagement, or what other allies have you done in like mobilizing the media, or what have you done, those activities that you've done. So it will help you to track. The tools that we'll be using on this process monitoring is the advocacy log. Then you have your meeting tracker. You also have your media tracking sheet. So if you engage with the media, you have a three-format meeting and that you had with some officials within the 6 weeks. So you track that. And when you are monitoring, the second one is your outcome monitoring. So these are your medium terms, like how the influence that you've made over time. So this key question that you need to ask yourself is our advocacy shaping attitude? Is it shaping dialogue? Is it, or are you getting commitment from those that you've advocated to? So one of the things that this help you do is to track your early signs of influence before the policy change. So maybe you've advocated for something that you need them to change a policy. So you are now monitoring to see the outcome of that which you've advocated for, if these policymakers have agreed to change this policy or so. So example is the public statements by the policymakers that that may issue, including maybe draft or budgets, a draft or the budget that they've developed, or an invitation to policy dialogue, or maybe an improved media framing. So you will know that, oh, this, at least they are taking steps towards your advocacy. You've advocated to them and you've influenced their decision and they are taking the step to take those changes. So some of the tools that we'll be using, like you have your policy outcome tracker, you have the media sentiment review, you have your stakeholders feedback notes. So an example of this can be the minister committing to reviewing the framework at the National Council of Health. So you know that your advocacy has worked. The third thing you'll be monitoring also is the impact monitoring. So this is your long-term, this is your long-term indicator. So you are looking at the change that has happened. So from when you did your advocacy to the you influencing them, and then now the change that your influence have made. So one of the key questions that you'll be asking is, what long-term change did this advocacy contribute to? So this will help you to track your cumulative policy and system changes. So example like maybe policy adoption or amendments, also budget increase, or maybe circular issues or implemented. So you also have maybe there's improved workforce retention. So you know that your advocacy have actually worked. So one of the things you need to note is that you need to document these contributions and not just sole attributes. So example of this, you need to revise, example is the revised salaries and curriculum that has been implemented at the beginning of quarter 3 after the sustained advocacy. Next slide. Okay, so there are simple tools that you can use for your monitoring and evaluation when it comes to advocacy. So we call them the simple advocacy M&E tools. So number one, like I've discussed earlier, we talk about the advocacy log. And like I said, this helps you to track your day-to-day actions and your follow-up that you need to do. And so you look at what you need to have on your advocacy log. So the date, the activity, the stakeholders, the outcome, and what follow-up that you need to do in order for you to ensure that you have a smart advocacy. So the purpose of this is to ensure that your actions are documented and not forgotten. Like we said, what's not documented is like you have not done anything at all. So you need to ensure that you document everything you do. So the second one is the advocacy scorecard. So this is for you to have a quick snapshot of your progress. This help you to get a quick snapshot of your progress. Like you can use status signal, like activities that if you are on track, you can put it on green. If you are maybe partially on track, you can put it on yellow. And then if you have any pending activity, you can put it on red. So this will help you to see, like at a glance, your progress that you've been making. And this help you as a leader to see your gaps at a glance, like if you have strong engagement, or you have maybe weakness in your media engagement, or maybe there are still some policy that you've advocated to and they are still pending. So this will just help you to know areas that you need to strengthen more. So the last one, which is the stakeholders influence map. So this, you need to update this quarterly, because like your stakeholders, when you're able to identify who have the strength, when you're able to identify their strength, their weaknesses, and their opportunity. So this will help you to know which of your stakeholders you need to engage to give you your quick results that you need. So these help you to track power and position. So one thing you need to know, some questions that you need to ask yourself is that who is shifting from your neutral to being supportive? Like you have a stakeholders before you put it on neutral, and now your stakeholders, there's sometimes that your stakeholders can shift from being neutral to being supportive. And then you need to also ask who remain resistant, who you've been advocating to those people and they still remain resistant to you. So you'll be able to track those. And then who need renewed engagement, who need you to always and renew their engagement. So this will help you to track your stakeholders' influence. Next slide. Oh, the next slide. Okay. So when do we need to review our advocacy, monitoring, and evaluation? So number one, you have to look at the timeline and also the purpose of your advocacy. So you can review monthly when you review your activities and adjust your tactics. And then for quarterly, you can assess your outcome, and then your stakeholders shift. Some of your stakeholders may be your strongest supporters from where they were. Now they are strongly supporting you, and some again may be lacking behind that you need to advocate more to. And then you also need to look at it annually. So when you are looking at your your advocacy annually, reviewing it annually, it helps you to reflect on the impact and the lessons that you've learned, so that moving forward you'll be able to adjust some of those lessons learned, and then to improve more of your advocacy. So what are the key advocacy M&E questions that we need to ask regularly? So number one thing you need to ask yourself, are we speaking to the right decision makers? So this will help you know if you're actually on track. Number two is our ask still relevant given the political or fiscal realities? So you have to ask these questions. Number three, which airlines are most effective that when you engage them, you'll be able to get your key asks immediately? So you also need to ask, what resistance are we seeing and why? So why are these people being resistant to you despite you've administered your smart advocacy, you've done your follow-up and everything, but why are they still resistant? So you need to ask yourself that question. And then the last one, what should we stop? And what should we start, or what should we strengthen? Because you'll be able to document all this, so you'll be able to look at it and ask yourself this question, know when to stop and when you need to start, and what you need to strengthen in your advocacy. Next slide. So one thing we need to know, like when you're advocating, you have to have a critical mindset shift. You're advocating for people to shift their mindset from where they are into where you want them to be, or into doing their activity or that advocacy that you want them to. So one thing we should know is that advocacy success is not only policy change, it's a movement. So you want people to move from where they are to where you want them to be. So the movements, when you are in a right track, and your movement should look like you have increased access to your decision makers, you have greater legacy and credibility, you have clearer timelines and commitments, and then you also have reduced resistance. So because you know that your advocacy is actually working, so you also have stronger coalition with your those that you're advocating to. So, what are the credible advocacy reports? What's your credible advocacy will look like? Like, for example, maybe you've done advocacy for over 6 months, and then the NCDC for over 6 months, the NCDC conducted 8 advocacy engagements, and then out of that 8 engagement, they were able to secure 2 high-level policy commitments, and then shifted media framing and contributed to inclusion of the healthcare workers welfare into the draft 2026 budget. So you see how your advocacy have moved, you've advocated, and then they've already, and the policymakers have already met, and this your goal is for them to include the healthcare workers welfare into the 2026 budget, and which they have done. So this shows the activity, influence, and then the contribution, not just effort. So you have to move, you get what you want them to do for you. So this shows that your advocacy have really worked. Next slide. So my final takeaway is that what gets measured gets managed. So when what you measure, you'll be able to manage it, and what gets followed up gets done. So any key things that you need to follow up, you need to ensure that you follow them up to get it done. And then your advocacy without monitoring is hope, like you just hoping for something to happen when you don't monitor your advocacy. So advocacy with the M&E is strategy. So you always have to ensure that you do your monitoring and evaluation in your advocacy to help you achieve your strategy that you want to achieve. Next slide. So these are acknowledgement. Next. Thank you for listening.
Thank you very much, Sarah Peter, for that presentation, and an in-depth one as that. Unfortunately, we have overshot our time by 3 minutes now. So what we're going to do is the questions and answers that are left to be responded to will be responded post-webinar and also shared with all participants alongside the recording and other resources that would be required. So what I'll do now is hand over to Dr. Yaya Disu to just help us close the webinar. And over to you, sir.
Okay, thank you very much, the moderator, and then all the panelists, and as well as the participants and all those who have contributed by asking questions. All the insights we have generated from this definitely is going to make us to all work together to see how to improve on how we advocate for Lassa fever control in our communities. And then remember, collaboration is the key word. One person cannot do it alone. Let's move from learning to living a legacy. It's important. We have learned this, and the kits, the two kits, the recordings of these videos will be shared. Let's continue to practice. Please feel free to reach out to NCDC colleagues who are there, or ASDI colleagues, and for questions, for clarification of how to implement what we have learned if we are having any challenges. We can also reach out to see how we can share experience. And I'm sure we'll come up with a platform where there will be interaction by those who have participated and those who even listen to the video who never participated in this. So I want to thank authorities in NCDC who provided the platform for this collaboration, and then those who have spared times, all the participants who have, considered this important to attend, the feel this is worthy of their time. And as well, those who have worked hard behind the scene to make this a reality, to make it seamless, particularly Dr. Olayinka, the technical director in ASDI, and then the NCDC team, and Natu Bello, Yetunde Abioye, the incident management for Lassa fever. They've been working tirelessly to ensure that today is successful. And then the moderator too, we keep reaching out to the moderator to see what he can do, how to pull everybody together. And then even our international consultant who participated from outside Nigeria, I'm sure she's doing this in the middle of the night. Meyiwa, thank you very much for your sacrifice. And Sarah and the rest of the team, we want to say thank you, Jakpari, who has worked behind the scene to ensure this has happened. Then there are other tools, members of the team from NCDC who we may not be seeing their faces, but they have all supported this. Thank you all, and we will see you in the next series of this webinar. Definitely we will share updates and whatever we're doing to keep everybody abreast of this. Thank you, and over. Bye.